My name is Joe Ingram, and today we'll be performing a medication administration. The first thing I would do is make note that I am working in a non-interruption zone, which means that I would avoid any interruptions. I would limit my conversations, and I would keep the door to the medication room closed if there was one. The second thing I will note is that I am working below waist level. Normally this would be considered unsanitary or contaminated. And the third thing I will do is list my 5 rights, which is right medication, right patient, right dose, right time, and right rep. And there's also a 6th right, but that doesn't happen until after the entire process, which is right documentation. Now I will verify the medication on the MAR, the medication administration record, which is morphine sulfate, 5 mg IM every 4 hours as needed for pain. And then compare that to the patient care order form, which is morphine sulfate, 5 mg IM every 4 hours as needed for pain. Here it is in blue. And then on the medication administration record, it is highlighted in green. The next thing I will do is perform hand hygiene. After I perform hand hygiene, I will select the correct medication and compare this to the MAR. This is morphine sulfate, 10 mg per milliliter, which is the correct medication for the dose, which is morphine per 5 mg IM every 4 hours as needed for pain. So I would calculate the dose, which is 10 milligrams per milliliter, and the dose is for 5 milligrams, so that would average out to be half a milliliter for the dose. And the vial itself of morphine sulfate does not expire until 12/20/2020. I would now ask for a second nurse to come and verify.
I see morphine sulfate, 10 milligrams per milliliter, and I see morphine sulfate, 5 milligrams IM every 4 hours, PRN for pain, for Mr. Jaguar Jones. Morphine sulfate, 5 milligrams IM every 4 hours, PRN for pain, and Mr. Jaguar Jones. You're good.
Thank you. I will now move on to gathering what I need for the injection, which is a 3 milliliter syringe, a 23 gauge needle, and a BD twin pack, of which we will be using for the needleless system. Next, I would grab an alcohol wipe to clean the vial. Before disposing. And then I would grab the syringe, dispose of its container, and take the BD twin pack, remove the cap, dispose, and then attach the needleless system. And then I would draw 5 milliliters of air, not 5 milliliters, 0.5 milliliters of air into the syringe. And then I will take the syringe with the needleless system and stab into the vial before depositing the air into the vial. Then I will turn the vial upside down and proceed to draw out half a milliliter of morphine sulfate. I will draw a little over half a milliliter so I can get rid of any bubbles in the solution. And then I can push back up to 0.5 milliliters to get rid of the last big bubbles if there are any. I will now remove the needleless system and deposit this in the trash. before taking my 23 gauge needle and attaching to my syringe. I will now take on a piece of tape, recording the patient's name, the medication, the route, the dose, and the actual time of the administration. The medication is for Jaguar Jones. Medication is morphine sulfate, 0.5 milliliters, which is also 5 milligrams, and it will be given intramuscularly every 4 hours as needed for pain. And this is how I will carry the syringe to the patient's room. I'm now done with the patient care order form, so I can put that off to the side and take my medication administration record with me to the patient's room, where I will first perform hand hygiene while explaining the procedure to the patient. I will raise the bed, lower the guardrail, and position them for injection. Perform hand hygiene once more before I look on the medication administration record to verify that this is the proper patient, the right patient. Jaguar Jones, medication record number is 4176352, and on the MAR it says Jaguar Jones, medication record number 4176352. So it is the proper patient, and I will also check for any allergies, which is penicillin, on the MAR and also on the patient's wristband. I will now perform hand hygiene once more before donning a pair of clean gloves, maintaining skin to skin and glove to glove. I will also put on a pair of goggles for preparing the injection site, of which this will be the deltoid for the intramuscular injection. I will grab another alcohol wipe to clean the site. Before disposing of, I will now palpate the skin to check for any redness, edema, or any elasticity of the actual skin. I will prepare my injection by removing the cap, but not throwing away. I'll take the syringe after spreading the patient's skin. Before I inject, I will aspirate for blood, and there is none, so I will continue with the injection. And now I will, using the scoop method, put the cap back on the syringe without capping it and immediately dispose into the sharp container. I'll now take a 2x2 and apply pressure to the injection site for about 30 seconds, watching for any adverse reaction, allergic reaction, or any bleeding or any pain from the patient. I will dispose of the 2x2, and then I will lower the bed, raise the guardrail, and I would return every 4 hours as needed for the patient to administer any other medication. I will remove my gloves and dispose before heading to the nurse's station to document the procedure, the patient's response to care, and that concludes the medication administration.